Welcome to Explain, a series of health education programs published by the Patient Education Institute, the leading provider of interactive health education. This video includes general medical information and does not replace the medical advice of your doctor or healthcare provider. If you have questions pertaining to your medical condition, ask your doctor or healthcare provider.
Uterine fibroids. Introduction. Fibroids are common, benign tumors of the uterus. They can cause significant pain as well as abnormal bleeding. About 30% of all women may have fibroids. Most of them do not have any symptoms. This program explains uterine fibroids and their causes, symptoms, diagnosis, and treatment options. Anatomy. The female reproductive organs include the vagina, the uterus, the fallopian tubes, the ovaries. The female reproductive organs are located in the pelvis, between the urinary bladder and the rectum. The ovaries have two main functions. One, the production of specialized hormones such as estrogen and progesterone. Two, ovulation, which is the release of eggs that are needed for reproduction. The hormones produced by the ovaries are very important in keeping ovulation regular. These hormones also prepare the inner lining of the uterus to proceed with a pregnancy. When an egg is released, it goes down to the uterus through the fallopian tube, where it may be fertilized. If the egg is not fertilized, the egg and the inner lining of the uterus are discharged to the outside of the body during the menstrual period. The uterus is pear-shaped. It is about 3 inches long and has 3 layers. The inner layer of the uterus is called the endometrium. As menopause approaches, periods become irregular and eventually stop. Menopause occurs when the ovaries quit making hormones and releasing eggs. When a woman gets pregnant, the fetus stays in the uterus until it is born. The uterus is able to expand greatly in size. The middle muscular layer of the uterus creates labor contractions, which cause the baby to come out. The lowest part of the uterus is called the cervix, which opens into the vagina. The vagina opens to the outside of the body between the urethra, which is the urinary bladder opening, and the rectum. The urinary bladder is located in front of the vagina and uterus. The kidneys drain urine into the bladder through 2 tubes called ureters. The intestines and the rectum are located above and behind the vagina and uterus. Fibroids. A tumor is an abnormal growth of cells and tissue. Benign tumors are non-cancerous and do not spread. Malignant tumors are cancerous, and they can spread to other parts of the body. Uterine fibroids are benign tumors in the uterus. They are not cancerous and almost never turn into cancer. Fibroids may grow as a single growth or in clusters. They may range in size from 1/10 of an inch to 8 inches in diameter. Uterine fibroids grow in the middle muscular layer of the uterus. This layer of muscle contracts during childbirth to push the baby out. Uterine fibroids may grow in the wall of the uterus, or they may project into the interior cavity or toward the outer surface of the uterus.
Sponsored by the Patient Education Institute. www.patient-education.com. Over 5,000 videos and interactive tutorials.
Symptoms. Most fibroids do not cause any symptoms and may be discovered during a routine examination. Some women who have uterine fibroids may experience symptoms such as excessive, painful, or prolonged bleeding during menstruation, bleeding between periods, a feeling of fullness in the lower abdomen, pressure or pain in the pelvic area, Other symptoms of uterine fibroids include frequent urination resulting from a fibroid that presses on the bladder, trouble emptying the bladder, constipation, pain during sexual intercourse, low back or leg pain. Causes. The factors that cause fibroids to grow in the uterus are not known. Almost all fibroids occur in women who are of reproductive age or old enough to have periods. About 25% of women of reproductive age have fibroids. African American women are more likely than Caucasian women to have fibroids. They also tend to have them at an earlier age. Athletic women seem to have a lower prevalence of uterine fibroids than women who do not engage in any athletic activities. Similarly, overweight women are more likely to have fibroids. Women who have given birth appear to be at a lower risk for fibroids. Diagnosis. Family doctors and gynecologists can diagnose fibroids fairly easily after obtaining a detailed medical history and performing a pelvic exam. Fibroids are the most frequently diagnosed tumor of the female pelvis. Ultrasounds of the pelvis may be needed in order to see the fibroids better. If ultrasound doesn't provide enough information, other tests may be needed. MRIs and CAT scans may also be done. Treatment. Most fibroids do not cause any symptoms and do not require treatment other than regular observation by a doctor. There are many ways to treat uterine fibroids that are causing problems. Some can affect a woman's ability to have children. Discuss the risks and benefits of any potential treatment options with your healthcare provider. For women who experience occasional pelvic pain or discomfort, a mild over-the-counter non-steroidal anti-inflammatory, NSAID, or pain-killing drug is effective. Cases that are more bothersome may require stronger prescription drugs. Medications such as birth control pills, a ring, patch, or IUD can prevent heavy bleeding, but they won't shrink the fibroids. Sometimes other medications are used to control heavy bleeding. GnRH, gonadotropin-releasing hormone analogs, can be used for a short time to shrink fibroids. They cause the ovaries to make less of certain hormones. If used long-term, they can lead to bone loss. In rare cases, a fibroid may press on and block the fallopian tube, which can result in infertility. After surgical removal of the fibroid, fertility is usually restored. The procedure to remove fibroids is called leiomyomectomy or myomectomy. The surgeon will use a large incision in the abdomen, multiple smaller incisions, or small tools inserted through the vagina to access and remove the fibroid. The procedure does not prevent fibroids from coming back. Your surgeon will go over the possible risks and complications with you. At times, the surgeon may decide that taking the whole uterus out along with the fibroids may be the best treatment. Such an operation is called a hysterectomy. After a hysterectomy, a woman is no longer able to have children. Another option for some women is to use heat or cold energy to destroy the fibroid instead of removing it. How involved the procedure is and its risks depend on where the fibroid is located. Sometimes the provider can treat heavy bleeding with an endometrial ablation. This procedure destroys the inner lining of the uterus, so the menstrual flow is lighter. Women usually cannot get pregnant after this procedure. Uterine fibroid embolization, UFE, can sometimes be used to cut off the blood supply to the uterus and the fibroids. This causes the fibroids to shrink. Sometimes after UFE, the particles that are put into the fibroids to cut off their blood supply travel to the ovaries. In a few women, the ovaries then stop working for a short time or permanently. Although researchers know that UFE may affect how ovaries function, they are unsure of how exactly UFE affects fertility. Talk with your healthcare providers about the risks and benefits of the procedure. Focused ultrasound ablation, or FUA, uses focused ultrasounds that are guided by magnetic resonance images to target and destroy some uterine fibroids. This is sometimes called focused ultrasound surgery, or FUS. Unlike traditional surgery, the procedure is non-invasive. This means no incision or cut is needed. The procedure may take up to 3 hours. It is intended to treat women who have completed childbearing or do not intend to become pregnant.
If you like this video, please like and share. For similar videos, subscribe to our channel.
Summary. Uterine fibroids are benign tumors in the uterus. They are not cancerous and almost never turn into cancer. Most women who have uterine fibroids do not have any symptoms and do not need treatment. Fibroids may grow as a single growth or in clusters. They may range in size from 1/10 of an inch to 8 inches in diameter. Family doctors and gynecologists can diagnose fibroids fairly easily after obtaining a detailed medical history and performing a pelvic exam. Fibroids are the most frequently diagnosed tumor of the female pelvis. There are many ways to treat uterine fibroids that are causing problems. Some can affect a woman's ability to have children. Be sure to discuss the risks and benefits of any potential treatment options with your healthcare provider. Thanks to medical advances, patients with uterine fibroids can live a very healthy and normal life. Thank you for using Explain.